Aze, good evening. How are you doing? Trust you're doing great. It's nice having you on the live. Sorry the live is starting really late. Like I could not finish what I have. I could not finish what I have on decks. So that's why the live is starting very late. I believe a lot of people will feel that I'm no longer coming tonight. And let's just see if they are going to get the notification and come around. Right, I'm starting really late. I know. I know I'm starting really late. Hello, Joy Johnson. How are you doing? I think I remember this name. Joy Johnson, you've been on our live before, if I'm not mistaken. And I think you have an older daughter. I don't know if you are the one. Sorry, because I have a lot of people on the live, so I can't really remember everybody. If you are the one, Joy Johnson, let me know. And it's nice having you on our live today. Thank you for joining the live. Hello, Joy Johnson. Izzy, okay, yeah, I really came late today. Yeah, I came late today. All right, hello everyone, and welcome to Nurses Lecture Room YouTube channel. This is our live sections. We usually go live from 10 p.m. to 11 p.m. every day to take as much questions as we can take. All right, that's what we normally do because most times we have a lot of questions under our comment section, and I am unable to meet up typing and replying those answers to the questions. So because of that, I was just like the best thing to do is to dedicate 1 hour every day to take questions from my audience. At least that is much easier because we have a lot, and typing I might spend more than 2 hours, and I don't have the full time because I am a nursing model and also a model of a toddler I'm taking care of. So this is how I'm able to like attend to my audience and at the same time attend to my kids. That's it. So that's why we're doing the live section from 10 p.m. to 11 p.m. every day to take your questions. Thank you all for joining our live. So we have Alex. Alex, how are you doing? Alex, it's nice having you on the live. If you have any questions, start dropping them now. Because if you notice in our previous live, I don't usually answer all the questions because most times it's more than 1 hour 30 minutes, and the live was supposed to last for 1 hour. The questions keep coming, and sometimes the questions come late. So if you have any questions, start typing them now so that we are able to finish up before 1 hour time. You understand what I mean? Because in the previous, I think 2-3 lives we did, I was unable to take all the questions on the live section, which was really a painful one for me, but it's not what I could really control. So I had to go away and say, okay, we're going to meet up in the next live. So if you have any questions, start typing them now before it gets too much and I have to postpone them. So we have Mr. Senya. Mr. Senya, how are you doing? Trust you're doing great. It's nice having you on our live. So Alex said, I am live streaming from Kenya. Alex, it's nice having you too. We have Moshe Batsewa. Hi there. Hello, Michelle. We have Exodus, my favorite nurse. How are you doing? I am fine, Exodus. It's nice having you. So we have Muna. Hey, hello, Muna. We have Malinga. Hello, beautiful. Thank you very much. We have Exodus Mupasu. Mupasu, how are you doing? Trust you are doing great. So is in administration of Artessolate injection. Okay, in terms of Artessolate, sorry, because it's been long I actually did this Artessolate injection in Nigeria, so I can't really remember exactly. I'm sorry about that. I can't really remember if you're mixing with water or water for injection of bicarbonate. Do you mix first with water for injection of bicarbonate? Artessolate, you mix it generally. You mix it with the water. That's the what. Generally, let me see if I can remember. Artessolate comes with its own fluid. The water comes together. So before you give it, before you administer, you have to mix it. You have to mix it. Personally, I would advise you follow the instructions on the Artessolate medication, or probably you can seek for a higher body. For example, the doctor on duty that particular day. Don't be shy to ask. Like ask from somebody that you know has been doing it. That's going to go a long way to help you, because I can't really remember vividly well how we usually miss the Artessolate. It's been like 5 years now, 4-5 years now since I administered the Artessolate injection back home. So Ayomide, hello, how are you doing? Trust you are doing great. So Joshua said, what is the best control method to use? What is the best control method to use? So the first question I'm going to be answering is from Joshua. First of all, welcome to Nurses Lecture Room, because I'm seeing everybody tripping in now. If you are coming across this channel for the first time, my name is Mercy Mary. I'm a registered nurse midwife from Nigeria, but I'm currently practicing in the UK as a registered adult nurse. Feel free to subscribe to our YouTube channel. Feel free to double tap and like this video, and also turn on the notification bell. Whenever we upload the video, you get notified and you join us, especially our live sections. So Joshua is asking, what is the best control P method to use? When it comes to best family planning method, I can't really say this is the best, because the best for me might not be the best for somebody else. I don't know if that makes sense. The best family planner method for me might not be the best for somebody else. For example, I might take Implanon on my hand, and the family planning method is working for me, no reaction, everything goes back to normal, just a few pounds weight gain. Somebody else might take that Implanon and they might react to it. You see them, they say, oh, I just do this family planning and I'm bleeding. So what I advise you to do is, when you get to the doctor, let the doctor provide you with different options. There are different types of family planning, and there are different side effects that one is likely going to encounter with it. So when they provide you with the various family planning options, you pick one that you want to try, that you feel is comfortable for you. Then when you go back home, always observe yourself after family planning. Observe for bleeding, observe for unusual discharge, observe for severe pain, observe for body temperature. In case of all this, if there is a change of in your cycle, there's a change in menses, if there's a change in your body temperature, this is something you should quickly go and see the doctor about. All right, so that's what I advise, because the best family planning method for me might not be the best family planning method for you. And aside the whole Implanon injectables, there's something that is the best. The overall best family planning method is actually the natural type of family planning method. The natural type of family planning method, and abstinence. Yes, if you can abstain from sex. Then the other is the natural type of family planning method, where you use your cycle as a lady to know your safe and your unsafe period, your fertile window and your non-fertile window. So these are really, like, I feel they are the best, in the sense that you are not putting anything into your body. And if you are trying as much as possible not to alter your hormones in the body, I will also advise them in IUD, intrauterine device. They hardly alter your hormones, unlike the Implanon and the pills you take that contains various hormones that tends to alter your hormones in your body. But IUD, I think it's okay, but everybody, like I earlier said, reacts differently to some family planning method. So go ahead with the options and see the one that best suits you. You can start with IUD first and see how it goes. If it's not working well for you, feel free to take it out and try other alternatives of family planning method. So that's what I have to say. Who asked that question actually? Joshua, just let me know if you get the answer to that question. Let me know if you got the answer to that question in the particular section, in the comment section. So we have Dada Taiwo. Taiwo, how are you doing? It's nice having you. We have Dean, hi from South Africa. It's nice having you, Dean. Alex, Artessolate comes with water for injection. You just mix. Yes, you mix it. But please read the instructions. You mix it, yes, but read the instructions. That's what I would advise you. So please, is it advisable to bathe my baby sponge and water every day? When you say bathing your baby with sponge and water every day, it's like a personal decision. That's what I would say. Personally, I prefer bathing my child every single day. It might not be this strong sponge. It might just be a towel, so a very soft towel, using it, a very soft towel, like towel, like a very soft sponge. If you want to get sponge, not those hard sponge, because some research said that when you sponge the upper layer of your skin, it tends to take away the protective nature of your skin. But when you are in a place where everywhere is hot, everywhere is always hot, you're sweaty, oils are being released in your body, oils is in the skin, so it's advisable for you to at least bathe them every day. Even if you're not using sponge and soap every day, just shower them at least every day. But I personally advise using a soft towel and a mild soap every day. That's my personal advice. But generally, the advice you can do alternate days, but also look at the condition surrounding it. Is the area, like, is it very hot? If it's very hot, you can't just leave your baby like that if the weather is very hot. So that's what I advise for you, Dada Taiwo. Just let me know if you got the answer in the comment section. Um, Joshua, let me finish up with Joshua. Joshua is asking how reliable is the natural method? In terms of the natural method of family planning, it is not 100% reliable. And there's something you should know is that no family planning method, be it implantor, be it IUD, is 100% effective. No family planning method is 100% effective. In terms of the natural method, it's a bit dicey in the sense that if there is a mistake, you can easily take in. But no matter the family planning method, none of them is 100% effective. But the other ones like the implantor, they are more than, I think, 94, 95, 96, 90% and above percentage effective compared to the natural method of family planning method. So I think that is clear, Joshua. I think your question has been answered, Joshua. So Muna said, in an emergency case of respiratory distress, such as asthma, and there is no salbutamol, what can we administer to the patient? There's respiratory distress, such as asthma. Is there oxygen? Yeah, like if there's a possibility of you increasing the flow of the oxygen, I think that will go a long way to help. If there's a possibility of you increasing the flow of oxygen, that is a long way to help. And if that is a hospital setting or even in schools, it's advisable for all schools to have the emergency drugs like all the salbutamol and all that. So even in school, it's advisable for you to have those emergency drugs. So if you're in a hospital and they don't have salbutamol, make sure they have that in excess, please and please. Salbutamol is very important. And inhalers, make sure that inhalers are at the what am I saying? Make sure inhalers are available. That's what I wanted to say. All right. So Zachary said, Zachary is here. Zachary, close to the end of the live yesterday, I kept calling your name and asking, where's your question? Where's your question? Where's your question? If you're alive, but it's like you left on time, so we could not really answer your question. So today we should answer that. Zachary. Zachary said, good evening, nurse. How's work and how's the family? Hope you're doing well. Yesterday, I was waiting for you to answer my question, but you go off without answering my question. Please answer me now. That's what I'm saying, Zachary. Zachary, what happened yesterday? I was actually calling your name and asking if you were live. I called your name several times, but you were not on the live section. So I had to go because I didn't see you and I didn't want to take the questions without you being there. So, role of a nurse in patient care, assignment given by my university, but I don't know how to write. The role of a nurse in patient care. As a nurse, like, though this particular live section is not for nursing students, but I'll just tell you what to do. I'll just give you a summary of what you should like focus your attention on, because the question is role of a nurse in patient care assignment. Your role of a nurse is not just like physical. You as a nurse, you are having how will I put it now? You're having the role of an advocate, as little as the role of an advocate, as little as the role of a psychologist. It's more or less like, do you know the role of a mother? You know, they tell you that mothers have different functions when it comes to their child. The mothers are the doctors, the mothers are the nurses, the mothers are the psychologists, that is the same way the role of nurses in patient care looks like. That's the same way the role of nurses in patient care looks like. It's just like a broad rule. It's not narrowed down to a particular thing. So it's broad. So you have to like think broadly and think widely in regards to that. Tom and Jerry, I hope that answers your question. So we're going to help Zachary calculate. Zachary, if you are watching, just let me know, because I don't want to calculate it without you being here. So Zachary, drop on the comment section if you are watching so that I can go ahead and calculate it, because I don't want to do that without you being on the comment section. Tom and Jerry, did you get what I said? Tom and Jerry, if you don't get what I said, I'm going to explain every int in details. Just let me know. Then when I finish with Zachary, I will explain the role of nurse in patient's care. Zachary, let me know if you get it. Okay, let's finish with what's the name? Let me finish with Zachary first. So Zachary is online, so let's do it. Zachary said on April 19th, he saw the wife saw her menses. So April has how many days? 30 days. That's September, April, June, and November. So April has 30 days. So on the 30th of April, 19th of April. So I'm going to asterisk 19th of April. I'm doing that now. Then May 17th, that's May 17th, and June 15th, June 15th, April, May, June 15th, then July 14th, July 14th. So April has how many days? We're calculating for Zachary. We're calculating Zachary's cycle. April has 30 days. April has 30 days. 30 days are September, April, June, and November. April, May, June, July. 30 days have September, April, May, April. 30 days of September, April, June, and November. So I think May is 30. Please just answer me in the comment section. I don't have a spare calendar with me. Can you help me open? I want to check the calendar. Thank you. I want to just see the calendar quickly. Just to be sure how many days is in this cycle. Let me just check. I don't want to make a mistake. So I want to check how many days. April has 30 days. We're correct. May has 31 days. May has 31 days. Good. June has 30 days. Okay. July has 31 days. Then August has 31 days. August has 31 days. So I'm going to be calculating. Thank you very much. Stargirl, how are you doing? It's nice having you on our live section today. Thank you, Stargirl. All right, so April has 30 days. So we're going to be calculating. You said your wife saw her period on the 19th of April, May 17th. So we're going to be calculating. I will advise you, Zachary, to listen how to calculate it just in case, so we don't end up calculating it in next live sections. So we're going to be calculating from April 19th to a day before the start of the next period. In May, the period started in May 17th. So we're going to be calculating from April 19th to May 16th to get your cycle. April 19th to May 16th. So 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. So the first one says it's 28 days. Let me check from May to June. I'm going to be calculating. So we're going to be calculating from May 17 to June 14. So 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. That's 29. Then from June to July, so we're going to be calculating from July 13th to June 15. So 13, this 13, okay, this 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. So on an average, Zachary, your wife has a 29-day cycle. Thank you very much. So on an average, Zachary, if you are listening, I want you to be dropping it on the comment section that you are listening. Godia, how are you doing? Trust you are doing great. So on an average, your wife has a 29-day cycle. If we say your wife has a 29-day cycle, so to get the ovulation, that's the day she's releasing egg, it's going to be 29 days minus 14. 29 minus 14. So if you subtract 29 from 14, you're going to be getting 15. You're going to be getting 15 days. So what you have to do is to count 15 days from the day she started seeing her period. So you said on the comment section, which day did she see her period in July? Now, she saw her period on the 14th of July. So her ovulation is likely going to be 15 days from the 14th of July, which is probably July 31st. So 14, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Sorry, it's not 31st, sorry. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So on the 28th of July is likely going to be her ovulation day. So what's today's date? Today's date is 23. So from the figures you gave me now, on the 28th of July is going to be her ovulation day. And that 28th of July is the likely day she might release egg. That 28th of July is a day that increases your chances. If it's actually the date you gave me, is a date that actually increase your chances of giving birth to a male child. Like I earlier said, be it a male child or a female child, all are gifts from God. So what should matter more is actually a healthy child anyway. So on the 28th of July is likely going to be her ovulation day. So what I would advise her to do during this period, try as much as possible not to take unnecessary painkillers. If the pain is not severe, if she doesn't need it, she should not take it. Because drugs, painkillers, malaria medications, any drugs you are on safe, they tend to alter your body, they tend to affect your menses, your menstrual flow. So if you notice as an individual, if you notice your wife or your wife has ever told you, whenever she's sick or she's on any medication, there's going to be a slight change in her menses. Either 1 day delay, 2 days delay, 3 days delay, it comes early, it comes late. So when you are sick, when she's stressed out, that can alter her cycle. If there is no alteration, there's a likelihood that she's going to be ovulating on the 28th of July. So generally from science, you do plus or minus 2, but we are holding on to 28th of July, but you can do plus or minus 2. So that's that. I don't know if Zachary, you get that now. So what is going to be happening if the cycle is regular continuously like this? From her menses, count 15 days. That's going to be telling you, oh, she's on ovulation these days. So you're able to know, okay, when your wife is ovulating. So every 15 days from her menses, just have a clue that she could be ovulating around that period. 15 days from her menses. So Zachary, is that clear now? Zachary, is that clear now? Okay, he said, yes, I understand. Okay, that's good. So we are done with Zachary's question. And where is Tom and Jerry? I don't know if Tom and Jerry is still on the live section. Tom and Jerry, if you're on the live section, I really want to explain your question to you now. If you're on the live section, can you let me know so that I can explain your question in details? Tom and Jerry, if you're on the live section, kindly let me know so that I can explain your question in details. Okay, Zachary said, yes, I get that. I get it very well. Okay, that's good. It's nice knowing that you have it. So if you have any question, feel free to drop on the comment section. And if you want us to help you calculate your ovulation cycle, your menstrual cycle, kindly let us know in the comment section. We are here to calculate it. Okay, so Zachary said, may God reward you and bless you abundantly. Amen. Thank you very much, Zachary, for the prayers. So Stargate says, what else can someone take to replace painkillers? Because I notice whenever I take ibuprofen, my period cease, but the cramps do force me to take painkillers. In terms of your period, taking ibuprofen, like if the pain is severe, like Ella said, if it's severe, it's not bearable, you can take it. And other ways you can help with painkillers to help with the pain is actually let's say a cold or a cold compress. If you can put something cold around that area. When you go to the pharmacy, depending on where you are located, I think in the UK here, they have a menstrual cramp pack where you buy the pack. It has all the things that can help you relieve pain. And diversional therapy, if you can, because I know menstrual pain differs from person to person. Every individual has their threshold when it comes to menstrual pain. Like sometimes it's really, really bad. That some require extremely strong painkillers like codeine and some opioids. It can be really bad. So what I'm trying to let you know is that you can use that cold compress. You can actually use diversional therapy, go away from the house, do something. Personally, when I'm on my menses, let me use myself as an example. I try to be on duty that day because when I'm working at work, I don't usually have, like, I know I'm at work, so I need to work. So I try to divert my attention from that menstrual pain. So most times when I'm on my menses, even if I'm not working, I try to look for shifts that particular day. I try to like look for extra shifts that particular day just to get me out of the house. Because if I'm at the house that particular day, I might focus my whole energy on that pain, and at the end of the day, I become useless and I become non-productive that day. So it, like I earlier said, it all depends on individual pain. But if your pain can allow you go to work and function, that is also an easy way to take your mind away from your menstrual pain. So that's one thing I have to say, Stargate, and I hope that helps. I think Stargate, you're in USA. In USA, I think they should have the pack. They should have the menstrual cramp pack. So it contains everything that helps. Just type on Amazon menstrual cramp pack or go to the pharmacy and see if they have it. Probably they will have. Then you get it and see what they even give you what to eat on that particular day. I think some box of chocolates can also be inside. So that's something you can take note of. I hope that answered your question. Thank you. I'll search for it. You're welcome. I think they should have it in the US. Muna Leah say, actually, you may really expect this, but I need your answer before I go. As a nurse, you heal people every day, but who heals you when life gets heavy? Who heals us when life gets family? Yeah, when if it's not medical, like if it's not medical, as a nurse, we go to the hospital, we still take medications, we take our drugs, we are being admitted. When surgery is needed, we go for surgery. But when life gets heavy, you are talking about, I believe you're talking about the psychological aspect of being a nurse. I think having a family, a good family, having family members to actually reckon on, having family members that you can confide on, having family members that you can talk to and they actually hear you is going to go a long way to help when life gets heavy. But if you don't have anybody at home, if you don't have any family member to come, it might be difficult because when you go out there, there's a lot happening around there. When you go out there, you see a lot. Sometimes you are traumatized, but you still try to stay strong. You try to be like empathetic. You try to like help the patient out. You try to be strong for the patient, even if sometimes you are feeling down, you are feeling bad for this patient, but you can't feel down for the patient, but rather you have to stand strong for this patient. But when you get home, sometimes you reflect on what happened and you feel, oh, something happened, I'm feeling down. So having a close person, not having a close person to just share or spend a time with is going to go a long way to help. When I mean having a close person to share, I'm not talking about sharing the patient's information or sharing the patient's details. I'm talking about sharing how you feel at that particular moment. So having someone you can explain how you feel is going to go a long way to help. So family is one of the way nurses are able to heal them their heavy hearts. So we have David Kumaya. How are you doing? Trust you are doing great. We are still in the question and answer section. If you have any question, feel free to drop on the comment section. I am ready and available to take these questions for you all. Okay, so that's it. Ask your questions in the comment section. Muna, I believe your question has been answered. Zachary's question has been answered. Stargate's question has been answered. Who else again? Joshua's question has been answered. Tom and Jerry, I can't find Tom and Jerry. I didn't know where Tom and Jerry has gone. I mean. Okay, Ozema said, I'm 37. I have 3 girls, and I really need a baby boy. How can I achieve this? Blessing, what I would advise is that no matter what you see online, no matter what we teach you online about how to get a baby boy, how some people got a baby boy, it is not 100% effective. It is not 100% effective. That is what I keep saying. And also, when you do that, it's more or less like, okay, let's see how it goes. It works for some and some it doesn't. So if you want to give it a try, the first thing to do is actually to know your cycle, is to know your menstrual cycle. When you know your menstrual cycle, it is much easier for you to play the dice of having a male child. So the first question I need to ask you is, Blessing, do you know your menstrual cycle? Have you ever tracked your ovulation? Do you know the day you are releasing your egg as a lady? So if you know that, it is much easier. But if you don't know that, that's where we have to start from. If it's to start this month and start tracking your ovulation, start tracking your menstrual cycle. It's going to go a long way when it comes to the conception of a male child. But I'm still repeating it, it is not 100% effective. But for those that really want to get a male child and they have the financial capacity to do that outside the normal way, IVF is one of the way, is one of the, like, I feel in some countries, they allow for gender selections when you do IVF. Why in some country? I think in the UK, they don't allow for gender selections. I don't think so. But outside the country, they allowed for, in some countries, they allow you to select, to pick the gender you want during the implantation period and things like that. So I think you should also consider that. So Blessy, I don't know if I'm making sense. Did you get that? So David Kumuya said, questions about what? Okay, David, I believe you are new on our YouTube channel. My name is Mercy Miri. I'm a registered nurse midwife. I'm a member of the UK YouTube Health. And all we do on this channel is talk about health. All we do on this channel is talk about fertility, reproduction, sexual health, your health in general. So we provide answers to those questions that you might be shy to ask your doctors, or your doctors don't really have the whole time to explain in detail. So we try as much as possible to provide those answers. And we also advise in regards to personalized healthcare. In regards to your personal health care, it's advisable you see the doctor for one-to-one conversation, because what we just do here is to answer your questions, give a general advice, because we are not there with you. So that's it. So Blessy said, please, I cannot track it. I need your assistance. Thank you. In terms of tracking it, we've just helped Zachary to track his next ovulation, which is 28th of July. So if you want us to help you track your ovulation, what you would do for us is to give us the start date of your menses. If you have the start date of your menses in April, May, June, July, like at least 3 start dates of your menses. When I say start date, I mean the day you started your menses, 3 of them. If you can have the start date of your menses, it is much easier to calculate your menstrual cycle. If you have it now, we can help you out to calculate it. But if you don't have it, what I would advise you is that we are in the month of July. I believe you can remember the dates you started your July menses. Go and cycle it in your calendar. August, take note, cycle it in your calendar. September, take note, cycle it into your calendar. And with that, we are able to help you calculate your cycle and tell you when your next fertile days is going to be happening. And during this period, what I advise you is to stay away from unnecessary medications if you don't need them. If you are abusing drugs, if you are taking alcohol, if you are smoking, stay away from them, because things like this, they generally affect your body, and there's a likelihood that they are going to affect your menstrual cycle. And when they affect your menstrual cycle, it's going to affect you tracking the actual date of your ovulation. And if you can stay away from stress or look for a more wonderful way to actually manage your stress effectively well. So I don't know if I'm making sense, Blessing. Let me know in the comment section. So Stacy, officer, 11 years of marriage and no children. Wow. I know it's not easy. That's one thing I say. Like, it's someone that wears the shoe that knows how it hurts. I may be here giving all the advice out, like, okay, take care, take heart, like it's going to come, keep trying. But I am not the one wearing the shoe. I believe you know how it hurts more. And I know it's not easy for you as a woman, especially when you want kids and it's 11 years and kids are not coming. So one thing I would advise you to do, first of all, is to see a fertility specialist, fertility expert. I don't know if you've seen any. You get, if you've not seen any fertility doctor, it is high time you see a fertility doctor. Let them check. If they can analyze you, they can do some scan, they can do some general body checkup to find out if there's any cause for the infertility. And while you are trying to do your own findings, while you are trying to get the scan and the various tests done, it is also advisable for you to take your spouse, your partner, alongside to get his semen analyzed, because fertility is not just a one-way thing. It's not just a woman thing. It's both the woman and the man. Because even if as a woman you are releasing egg, if the sperm is not okay, getting pregnant becomes difficult. So that is why while the women are trying to get it sorted out, they're trying to do their scan, they're trying to do the various fertility tests, the men should also go alongside with them just to make sure both parties are safe. Then for Stacy, what I would like to ask you is, do you know your cycle? That's one. Are you seeing your menses every month? Do you see your menses every month? If you see your menses every month, drop on the comment section. Let me know. So Muna said, Osema said, I'm considering my age. How many percent chance do have a child? I don't know your age, I don't know your age, blessing, but one thing I'm sure of is that if you know your cycle, if you are seeing your menses every month, there's a higher chance that you're going to conceive because you are seeing your menses. As well, you are seeing your menses every month. It's a sign that your body is releasing egg every month. But as you age, as you increase in age, the patency, the quality of your egg actually decreases. The quality of the egg generally decreases with age, and infertility chances increases as you age. So if you want to try something, I advise you try it as soon as possible because as you age, everything goes down when it comes to fertility. So that's how it is. So Muna said, yup, it's my privilege. It's a privilege being here. Thank you, Muna. Ozema Blessing said, okay, thank you very much, Ma. You're welcome. We are still taking questions. We still have a long way to go. Feel free to drop your questions in the comment section. And if you're watching this live and you've not double tapped the screen to like the video, I will advise you double tap the screen to like the video. It actually shows that you appreciate the work and you are getting a lot from the live section. All you have to do is to double tap the screen. Just tap on the screen twice and it automatically likes the video. You are not paying for it. And if you are new on this channel, feel free to subscribe to our YouTube channel, turn on the notification bell so whenever we go live or whenever we drop a video, you are actually forced to watch that video and also join our live with your boardroom questions. So Ozema Blessing said, I'm 37 years old. 37 years old, you're still good to go. You can still have babies. And do you see your menses regularly? Are you ovulate? Are you seeing your menses every month? And okay, you said you don't have idea of your cycle. So if you are seeing your menses every month, the first start is to just know when you have like the start of your menses every month. Track it for like 3 months. And with that, we are able to help you calculate your ovulation and you're able to know when you're ovulating and when you're not. Isa Sakari said, now that the ovulation date appears 28th of this month and plus or minus, which is 26, 27, 28, 29, and 30th. So can we start now or to the date? Today is not 27. You want a male child, right? If you start now, it's a female child you are planning for. Yes. Like I said, it's a dicey thing. I'm not saying it's 100% effective. So in general, I will advise you actually start on the 27th, though it's plus or minus 2, like I earlier said. I will advise you start on the 27th. I'll advise you do something on the 27th. So you have 28, 7, 28, 29, 30. Okay, so I will advise 27th. So Ozema Blessing said yes. Okay, if you see your menses every month, that's a sign that you're ovulating. So everything should be fine. So what you have to do is to track your ovulation now. So every month, always put the date down. From that's the only way you can calculate your cycle effectively. Just put the date down. Stacy Officer said, yes, I see it every month. Last month on the 28th. So you see your menses every month. That's a sign that you're ovulating. That's a sign your body is releasing egg. Have your husband gone for semen analysis? Like they call it sperm count. Has he gone to check his sperm? Because like I earlier said, fertility is not just a one-way thing. It's a two-way thing. If something is wrong with the man, it can be difficult to conceive. I think recent research, I can't really remember. I think recent research said 45%. I don't know. I'm not sure. 45% of fertility cases as a result of the man issues. Yeah. Okay, I just wanted to confirm it's 20%. 20%. Okay. Different researchers are saying different things. One research said 30% of cases of infertility can be attributed to female, 30 solely to the male, and 30 combination of both partners, and 10% is unknown. So Muna Lisa say, for an obese patient who is over 60 years who want to undergo surgery for weight reduction, what surgery would you recommend as a nurse? 60 years, undergo a surgery for reduction. Personally, I don't have idea in regards to this weight loss, so I can't do any recommendation. If it's something I have idea, I would be able to recommend, but I don't have idea about surgeries and when it comes to weight loss surgeries. So I can't really recommend if which one is better, because it's when you know the side effect of one, the advantage and disadvantage of one, that it is much easier for you to provide helpful advice. But in regards to weight surgery reduction, I don't know in details the good and the bad, the pros and the cons. So I can't really advise what you should do when someone is about 60 years of age. You said it's weight loss, weight reduction, gastric sleeve, or bypass. I think that's something I need to actually study, gastric sleeve or bypass. That's something I will study and get back. So let's keep the questions coming. Do we have much questions? We still have up to like 20 minutes to spend on this live. If you are watching, feel free to double tap on the screen to like the live section. She said, and she has no severe reflux. Like I earlier said, Muna, I really have no idea. So I can't provide answers in regards to weight loss surgery. I can't provide answers in regards to that. All right. So I don't give you wrong advice. So I can't provide answers in regards to that. Jenny girl, how are you doing? Trust you're doing great. I have a lot of Jennifer. Is this Jenny girl someone I know? Is this Jenny girl someone I know? Hello, Jenny. How are you doing? I have a lot of Jenny as students, nurses. I have a lot of Jenny as nurses that have graduated. I have a lot of Jennies. Do I have a lot of Jenny in the UK? No, I don't think I have a lot of Jenny in the UK. I think I only have just one Jenny in the UK. But Jenny girl, it's nice to see you on our live section. Thank you for joining our live. And if you have any question, feel free to drop on the comment section. We are ready to take your questions. It's nice to see you here. Okay, Jennifer said, please, what supplement will you advise for 35 plus trying to conceive? Okay, I'm going to give my general advice for 35 plus trying to conceive. This is my general advice. First of all, the first thing is know your cycle, track your ovulation. And when you've tracked your ovulation, you can get this, is it Well Woman? I'm not doing advert for anybody, but it's Well Woman. They have some combination of different vitamins that are actually very good for women. So you can get that, their pre-pregnancy conception. You check the makeup. I think it contains a lot of folic acid, because folic acid is very important when you are trying to conceive. Not because folic acid is a fertility drugs, but because folic acid is important for the brain and spinal cord formation of the baby. So when a woman does not take folic acid at the early stage of the pregnancy, when there's no enough folic acid in the body that's helping with the red blood cells production, that's not for you. When a woman doesn't take this folic acid, it can actually result in what we call this cerebral palsy, like children with spinal dysfunction, brain dysfunction. So folic acid is very important. So folic acid, whatever supplement you are taking as a woman trying to conceive, there should be folic acid in it. Then, if you can, frequent and regular sex, especially during your fertile windows. So not just having sex back to back, but your fertile windows, if possible, keep all the sperm in yourself. Then during the fertile window, have some good nice sex to help with it. So that's what I personally advise. I don't know if Jenny girl gets that advice, but make sure you calculate your cycle, make sure you track down your ovulation, and make sure whatsoever vitamin you're taking also have some folic acid in it. Eat healthy, stay away from processed food as much as you can. All those canned foods, stay away from it. Eat healthy. During this period, eat a lot of leafy green, a lot of fruits, a lot of veggies. Stay away from processed food. Stay away from canned food. Personally, I advise you stay away from those canned processed food. Eat a lot of fresh food that is homemade. Okay, so that's what I advise. So Chidima, how are you doing? Chidima, it's nice having you on our live today. So we have Okafo. Okafo said, I have a question. Feel free to drop your questions in the comment section. Jenny Girl said, thank you. You're welcome, Jenny Girl. So Okafo said, when a woman is pregnant of triplets, how many folic acid can she take? Is it 1 tablet or 3 tablets? So in terms of this particular question now, if a woman is pregnant for triplets, one thing is that when you are pregnant, I think in the UK here, I'm just going to use that as an example. They actually do a blood test to find that your hemoglobin level. They call it hemoglobin because folic acid help with your hemoglobin level. So if your hemoglobin is low, that's what is going to determine if you should increase the intake of your folic acid or not, even if you are pregnant with triplets or 1. So that, because it's a 3 baby or a 2 baby, more than 1 baby, you might need more than the required dosage of folic acid. You get, they might increase it. So, but they make sure that the test is done just to make sure you're not having excess of it. They might give you folates. They might give you, there are different types, but I advise that you go to a hospital where they can do some tests. They should check and see if your hemoglobin is within normal. If your hemoglobin is within normal, at a particular time of your pregnancy, they might tell you to stop taking the folic acid. It's not necessary. All right. So if you are a pregnant woman, you have 2 or 3 children growing inside of you, you might increase the dose. Yeah. Not necessarily like, oh, increase the dose to 3, increase the dose to 2. It might just be like, okay, 1 extra tablet. But it's advisable you check your hemoglobin level first to see if there's a need for you to increase it. And also, I am not an expert in this. You can actually confirm that from your doctor or midwife. So they're in a better position to give you that personalized health advice. So that's what I have to share with you, Okafor. And I hope that answered your question, Okafor. Okafor, let me know if your question has been answered. Okay, Okafor said thank you. But Okafor, if you have your wife or anybody, if anyone, I think are you a lady? Are you pregnant with twins? If you have a wife or anybody pregnant with twins, they are not supposed to take the normal dosage of folic acid because, like I said, it's very important. So you can increase it to 2, but always speak with your midwife. That's what I advise. Increase it to 2, increase it to 3, but speak with your midwife while you do that. 2 babies, secret, it's double. So that should actually send a message. Okay. Okafor said it's clear. Osmani T. Jallo said hi. Osmani, how are you doing? Trust you're doing great. It's nice having you all on our live section today. If you are watching this live section, all you have to do is to double tap the screen and like the video. If this is the first time of coming across this channel, my name is Mercy Mary. I'm a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. Feel free to subscribe and also turn on the notification bell so you don't miss out whenever I drop a new video. All right, so our live sections are daily, usually from 10 to 11 p.m. But today we started a bit late, so that's why we're extending it a bit. Okay, but in all, it's a 1 hour live section that usually starts from 10 p.m. and ends by 11 p.m. So we're here to take your questions. We are here to provide answers as much as we can. Okafal, are you pregnant for twins or triplets? Jalo, how are you doing? So we have approximately 10 minutes to go. If there's any question, feel free to drop in the comment section. And if you want us to help you calculate your cycle, drop in the comment section. I have a mini calendar here to help you out. This is Miss Mary calendar. It's my own personal calendar I made to help you calculate your cycle. Okay, Okafor said, I am a lady, not pregnant, but I hope to be in the future. Curiosity made me ask. Okay, that's good. That's good, Okafor. You have to take more, generally. You have to take more because you're having 2 babies is more. 3 babies should be more. All right? Because it's very, very important. It's like, how will I put it now? For example, this is a tube. You have 3 pipe. You understand? You have 3 pipes. So if you were taking one before, it will be difficult for that one to actually satisfy the 3 pipe. I don't know if I'm making sense. So if it's steady, you might need triple of what you were taking before. But in all, like I earlier said, always consult your midwife. You're going to need double more. But don't start taking three folic acid with the mindset that, oh, you're expecting 3 baby. You're expecting 3 baby. No. Folic acid is not a fertility drug. Folic acid is not the one stimulating your ovaries to release egg. All right. So it's not folic acid that will release 3 eggs. So folic acid is just to maintain the baby at the very early stage, especially the first 3 months of formation. The first 3 months of your baby forming, folic acid is very important, especially that first phase, that first 2 months, 2-3 months. It's very important. So good news, Akbar. Good news, Akbar. Hi, good evening, us. Good evening, Akman. How are you doing? Trust you're doing great. Okafor. Okay, that's nice. So we have like less than 10 minutes to go. Our life will be ending soon. If you have any question, it's a wrap. We're coming to the end of today's live. If you have any question, drop in the comment section. If you have any question, feel free to drop in the comment section as we end the live. Ask any question. Okay. Stargirl is asking, aside from IVF, how can one conceive triplets naturally? In some country, before I'm always putting the disclaimer because in some country this is not allowed. They can't even allow you to take drugs to conceive triplet naturally. But in some country, it is allowed. You can take, it's like a dicey thing too. It's not 100% sure. The doctors might prescribe, this should be prescribed by the doctor, not you. The doctors might prescribe something called Clomid. So drugs like Clomid actually helps to stimulate the ovaries. So they stimulate the ovaries and your ovaries release more eggs. So instead of your ovaries to release just 1 egg, it's releasing more eggs than the usual. So the ovaries might luckily release 3 at a time. It might release 2 at that particular time. So Clomid is one of the drug of choice that doctors can prescribe, but you have to see the doctor to guide you on how to go about it. but Clomid is an option. There are some other drugs that they can also use, but I think the most common one and popular one I usually hear about is Clomid. So Stargirl, is that answered? Is your question answered? And there are rules guiding the use of Clomid. You don't just sit down to use Clomid. There are rules and regulations guiding the use of Clomid. Because in some countries that I know of, you can get any medications over the counter. Yeah, you can get the Clomid over the counter. You can just go to the pharmacy and buy it. You don't even need doctor's prescription. But it is very important for you to get the guidance of a doctor to help you out. So Stargate said, yes, thank you. You're welcome. So the live is coming to an end. If you have any question, drop in the comment section. If you've not subscribed to our YouTube channel, click on the subscribe button and also turn on the notification button. If you are watching this video and you've not liked the video, all you have to do is to double tap the screen. Just tap your screen twice. That's all you need to do. You're not doing much. Just double tap the screen and it automatically likes the video. So this particular live is going to be ending in, let's say, 5 minutes time. It's going to be ending in 5 minutes time. So you still have an opportunity to ask your question and get answers for it. 5 minutes time, the live will be ending. Skydy, do you have a question for us today? How are you doing, Skydy? I know you asked us a question. Was it 2 lives? Was it on Monday? I see we had a question from Skydy. Skydy, do you have any question for us today? Because I'm seeing some question mark. If you have, feel free to drop now before the live end. Skyday. Okafor said you are the best. Thank you very much for that beautiful comment, Okafor. Our live is ending in 4 minutes time, hopefully. So for those that have not asked, this is an opportunity for you to finalize your question as we go off. So it's like 1 hour section every day. Oh, good news. Akman says, thank you for all your teaching. You're welcome. Thank you for dropping the comments. Stargate said, thank you for all your guidance. You're welcome. Thank you for the beautiful comments too. Thank you all for joining our live section today. It's going to be ending in, let's say, 2 minutes time. Our live section will be coming to an end. Thank you for all the beautiful comments. I see them. It's a privilege to be here. Thank you very much, Muna. Stacy Officer, blessing us. Thank you very much. It's nice having all of you here. So it's a privilege having all of you here on the channel. And if you've not liked the video, all you have to do, like I earlier said, double tap on the screen, 1, 2, and it automatically likes the video. You don't need to do much, just double tap the screen and it automatically likes this particular live section. Don't forget to subscribe to our YouTube channel, turn on the notification button, just in case we are having a live section or we just uploaded a video. So you will be the first person to get the notification and also join. Should the live come to an end now? Because there's no more question. There is Skydy. You said you wanted to ask some question. You dropped a question mark, but your questions are not appearing. So I'm sorry. Like I always say, if you are following us in our live sections, I said that sometimes when your questions are going against YouTube policies in regards to sex, romance, and things like that, your questions might not appear on my timeline. So if you're asking questions in my upcoming live, because this live is coming to an end, I can't take any other questions again. If you're asking any questions, try as much as possible to modify it, make it like modify it in such a way that it doesn't go against the social media policy, because some questions are not going to appear on my timeline when it goes against social media policy. So what I advise you to do is to modify it to make it appear on the live section. So I think we are done for today. If you have any other question, that should be tackled tomorrow from 10 p.m. to 11 p.m. And this should be a wrap. Once again, thank you all for joining our live section. Feel free to share the YouTube channel to your friends. Feel free to share the YouTube channels to your friends and all that. What did she ask? Please educate us on heteropaternal suffocation tomorrow. I think that should be a tomorrow topic. Like I earlier said, I'll just screenshot and see if it's something we can talk about tomorrow. So because we're done for today. Hey, Blessing, how are you doing? Ibeme Blessing. I think it's been long I saw you on the live section, Blessing. We have a lot of blessing, but I know this Ibeme blessing is different from the 2 blessings on the live section so far. So anyway, bye. Thank you all and see you tomorrow. Thank you.